Welcome to the BMAT Learning video, the Bedside Mobility Assessment Tool for Nurses, Pediatric Consideration. BMAT was validated as the Banner Mobility Assessment Tool by Banner Health. It was originally derived from the Quick 3 and Egress tests. It is also referred to as the Bedside Mobility Assessment Tool. The BMAT was not specifically validated on the pediatric population. However, the mobility concepts are consistent given some special considerations, which will be discussed here. Before you begin, we recommend a safety screening. The BMAT is recommended for patients over 4 years old. Ensure that your patient is able to follow directions. Do not perform the BMAT if the patient has bed rest orders. Assess the patient for other conditions which would make the BMAT unsafe for your patient. The BMAT should always be performed by a licensed nurse or therapist who is tasked with making clinical judgments about the patient. We will now review the assessment. The BMAT has 4 steps: sit and shake, stretch and point, stand, and walk. Before you begin, determine whether the patient uses assistive equipment at home. Assessment Level 1, sit and shake. Begin by describing the assessment process to the patient, reassuring them if needed. Ask the patient to come to the edge of bed without offering any manual assistance. Once your patient comes to a seated position and is able to maintain balance, reach across midline to shake the patient's hand. This will test for sitting balance. If your patient was unable to come to a seated position or maintain balance while sitting, he or she is considered Mobility Level 1. Consider the use of some of these safe patient handling and mobility equipment to assist your patient in movement and transfer. If your patient successfully completed the tasks of Assessment Level 1, move on to Assessment Level 2, stretch and point. Ask your patient to stretch her leg forward, then point and flex her foot. Demonstrate if needed. Remember, only measure the side the patient is intending to stand on. This tests the patient's quad strength and ability to attempt to stand. If your patient is unable to demonstrate appropriate quad strength as required of Assessment Level 2, your patient is considered Mobility Level 2. Consider some of these safe patient handling and mobility equipment to assist with transfers. If your patient completes the tasks of Assessment Level 2, move on to Assessment Level 3, stand. Ensure your patient's feet are firmly on the floor and with non-slip footwear. Ask your patient to come to a standing position for 5 seconds. She may hold the handrail if needed. If your patient is unable to come to a standing position or unable to maintain standing for 5 seconds, he or she is considered Mobility Level 3. Consider the use of some of these safe patient handling and mobility equipment to assist your patient with mobility. If your patient completes the tasks of Assessment Level 3 and requires the use of assistive equipment such as a walker, cane, or crutches, he or she is also considered Mobility Level 3. While many patients demonstrate independent mobility with the use of their assistive device, assigning the patient Mobility Level 3 helps ensure patient safety. It alerts staff to the need for assistance. It enables access to the assistive device if it is out of reach. And typically, these are higher fall risk patients. If your patient completes the tasks of Assessment Level 3, move on to Assessment Level 4. Even if your patient uses assistive equipment, it is recommended that you complete Assessment Level 4. This will give you a better idea of your patient's complete ability, although it will not change your patient's mobility score. Ask your patient to march in place, ensuring that each foot clears the floor. Next, ask your patient to take a step forward, then a step back, shifting her weight to the forward foot, then the back foot. Repeat with each side. At this point, the BMAT is complete, although you may desire to ask the patient to take some steps away from the bed to give you full confidence in your patient's walking ability. If your patient is able to successfully complete the tasks of Assessment Level 3 and does not require the use of assistive equipment, your patient is considered Mobility Level 4. However, it is always best to remind your patient to call, don't fall. Once the assessment is complete, spend some time on patient teach-back. Describe to the patient their level of mobility and describe any assistive equipment that may be needed to help the patient move and mobilize. This concludes the BMAT Pediatric Learning video. If you have any additional questions for the authors or are interested in some support tools, please email bmatconsultants@gmail.com.